My name is Skoly. I'm a practicing oral and maxillofacial surgeon here in Cranston, Rhode Island. When I started here 34 years ago, there were approximately 48 oral surgeons in the community. We have about 12 now. That shortage actually existed even before the pandemic. And some of it now is self-induced by some of the restrictive mandates and regulations that have unfortunately been put into place that really don't need to be there anymore.
When COVID came and most of us were sheltering in place, Dr. Skoly was out there performing necessary medical services for the community. He was the doctor that, at the height of the pandemic, was going into the areas where the less well-served were, the state psychiatric hospital, the state prison system.
If someone breaks their jaw, if someone gets shot in the face or the head and neck, somebody has to take care of them. We stayed right through the pandemic. I missed an appropriate time when I caught COVID in December of 2020. But after the appropriate quarantine, we came right back and did what we're trained to do. Unfortunately, when the vaccine mandate started, these healthcare workers, once heroes, were now being criticized for questioning the vaccine status, no matter how legitimate their concerns would be.
What happened here is that the state created a regulation and then terribly unfairly applied it so as to keep Dr. Skoly from practicing. The state made the decision that vaccination and N95 masking is equivalent for the purpose of patient protection. The mandate is being applied capriciously because it says to the exempt unvaccinated worker, you may keep your job and work right next to the patient so long as you wear an N95 mask. But it says to Dr. Skoly, who's unvaccinated, you may not keep your job and work right next to the patient, even though you're willing to wear an N95 mask. He's a maxillofacial surgeon. He wears an N95 mask, he wears a surgical mask, he wears gloves. When he is in the operating room with a patient, he looks like an astronaut. He engages in so much more to protect the patient. The mandate is irrational in a second way. It narrowly defines medical exemptions, and it doesn't include the condition of a person like Dr. Skoly.
I developed Bell's palsy twice as a result of Lyme disease, as a young adult. I knew that there was going to be a mandate in effect for October 1st. I then spent the time to challenge the mandate in an appropriate fashion and to get an appropriate medical exemption.
Dr. Skoly did not fit in to the medical exemptions as currently written, although he has a very good reason for not wanting to take. It is a violation of due process to make Dr. Skoly take this risk of temporary or permanent paralysis when there are rational alternatives available.
I've been vaccinated around the world for different things. I'm not an anti-vaxxer because I developed COVID-19 and I recovered and I had a level of antibodies. There is no need for me to get this vaccine at this time.
How can they justify this different treatment other than just saying, we're the state, submit to us and don't object? That's not the American way.
I almost feel like I've abandoned these patients. I feel like I've abandoned my staff and in a certain respect almost abandoned my profession. I am challenging this mandate because it is the right thing to do.